Hello, everybody. My name is Chris, and today we're going to be discussing amyotrophic lateral sclerosis disease, also known as ALS disease. ALS disease is a degenerative disease of the primary motor cortex. It can result in a decrease in mobility to a complete lack of mobility in an individual who has it. It is a progressive disease, so it gets gradually worse over time. And yeah, so looking at the different symptoms of this disease, the symptoms may be very subtle to start out with and therefore be overlooked, but they gradually become more severe over time. These symptoms can include frequent muscle cramps, muscle twitches in the leg, shoulder, or arms, slurred speech, difficulty chewing or swallowing, and the disease can either start in the hand or in the leg or a combination of both. When it starts in the hand, typically an individual will have a difficulty in reaching or grabbing, and when it starts in the leg, they'll have a difficulty walking. As it is a neural disease, it can also cause a decrease in the ability for an individual to make decisions, as it can spread to other pathways. And also, if an individual becomes aware of this disease's progression, they may develop some psychological symptoms such as anxiety or depression, as they're losing their motor control. In looking at the different diagnoses of this disease, much of the diagnostic testing for ALS involves using other tests to rule out other possible issues. So an individual may be subjected to a physical exam, blood or urine testing, MRI, electrophysiological testing, electromyography, or a proof of progression. So in a blood or urine test, they'll be looking for thyroid disease, HIV, hepatitis, or cancer. In an MRI, they'll be looking for herniated discs. In electrophysiological testing, they can identify damage to muscle or nerves unrelated to ALS. In electromyography, they could be looking for abnormal patterns of nerve activity. And with the proof of progression, they're looking to see if the disease is getting worse over time. If all these tests come back negative for their respective tests, then ALS is strongly considered and a plan is developed to treat it. In looking at the normal physiology of the brain, normal voluntary and involuntary control of the body's movements is controlled through what we know as the primary motor cortex. The primary motor cortex is a part of the motor association cortex, um, and this is going to be found in the frontal lobe of the brain, or the cerebral cortex. The different neurons in this primary motor cortex are going to control different functions of the body. So neurons in the superior region of the primary motor cortex will control the feet, trunk, and hands, whereas neurons in the inferior region control functions such as fingers, face, and lips. Motor neurons are unique cells, and without them, the body would not be able to act in the way we know it does. The functions of the neurons in the motor cortex. So there are millions of neurons that are interconnected throughout the brain. In order to cause movement, these neurons send action potentials, and which are impulses to each other. They're electrical impulses. And as these move throughout the body, they'll move down to the area in which um, the, the desired movement is supposed to occur. So the action potentials are sent through the brain via these interconnected neurons down the spinal cord via gray matter. And this pathway is known as the cortical spinal tract or the bulbar tracts, which can control muscle movement in order to achieve these desired movements of the body. As I mentioned, it's also going to be sent through gray matter. The gray matter is found in the spinal cord, and this is made up primarily of neural cell bodies, which are short and unmyelinated axons. And these impulses are carried down the motor fibers from the spinal cord to the designated area, and that's where the movement will occur with these muscle contractions. Then looking at the pathophysiology of ALS, As it is a degenerative disease, these motor neurons will lack the electrical impulses that they'd normally be able to carry out, as they are either destroyed or the myelin is destroyed. And that will slow the motor movement with this lack of myelin. And as there would be no motor neurons, there would be a lack of these electrical impulses, which will cause a lack of movement. ALS will cause sclerosis of the cortical spinal and cortical bulbar tracts. And what sclerosis is an abnormal hardening of body tissue. And the cortical spinal tract is going to be a white matter motor pathway controlling the movement of the limbs and trunk, whereas the cortical bulbar tract is a neural path that unites the cerebral cortex with the cranial nerve nuclei in the brainstem, which is involved in motor function. It can also cause a thinning of hypoglossal nerves, and the hypoglossal nerves are going to be what control the tongue. And with a lack of control of the tongue, individuals can have either a difficulty speaking or eating. It's also a progressive degeneration of motor neurons, which can lead to apoptosis. And finally, the exotoxicity is also thought to be a common in all of those with ALS. And what exotoxicity is this is a nerve cell death caused by high levels of intercellular calcium. And this intercellular calcium may be high due to excessive stimulation of glutamate. And the most abundant excitatory neurotransmitter in the nerves is glutamate. And too much of this glutamate can lead to overexciting of the neurons, leading to this cell death. So in looking at the different risk factors of ALS, ALS is found to have a range of different risk factors associated with it. So we have genetic factors, and it was found that the genetic, like hereditary ability to inherit this from your parents is very low, with only 90 or 10% of individuals actually inheriting like genes that can cause ALS. Two of the major genetic combinations of ALS known to date are the C9orf72 gene and the SOD1 gene, which are both protein coding genes. Physical factors. So high levels of physical fitness or lower body mass index than average have been shown to increase the risk of someone being found to have ALS. Occupational factors. It was reported that the occupational factors involving work environments with chemicals, pesticides, metals, and electromagnetic fields are at an increased risk of being diagnosed with ALS. And finally, dietary factors found that regular use of vitamin E supplements were associated with a lower risk of being put at risk by ALS. So higher vitamin E usage decreased your risk of ALS. So this here is two CAT scans. So the picture on the left is a healthy brain, and the picture on the right is one with ALS disease. The degeneration of brain tissue in the right photo is a clear display in comparison to that of the left. So you can see that this one has a lot less brain tissue than this photo here of the healthy brain. Looking at therapeutic intervention, as there is no cure for ALS, modern techniques can slow the spread or decline the loss of function caused by ALS. And this can be used through the medication Rilzuli, which works to reduce the damage to motor neurons by decreasing the levels of glutamate. And as glutamate is that excitatory neuron, this will just decrease the levels of glutamate. And this works specifically in the bulbar region. So looking at Rilzuli, It is a direct antagonist of sodium channels, which are associated with damaged neurons and NMDA receptors. And it works by preventing the release of glutamate from presynaptic terminals, which transport messages between the nerve cells and motor neurons. It also works to increase the rate of glutamate and how it clears away from the synapse, and therefore decreases the rate at which the nerve cells send signals to each other and eliminate the increased excretion of the nerve, or excitation of the nerve cells, sorry. Some side effects include headache, sweating, tightness, and facial pain. But in all, the medication, as with any treatment or therapy, can slow the spread of the disease, giving a patient slightly increased lifespan, but it is not a solution. And that concludes our presentation on ALS. Thank you very much.